if we were sort of taking a top-down view at your head,
Right.
and these are the eyeballs up here, the optic nerves, the nerves that control vision, sort of part of the nerve anyway, kind of comes to the center and then crosses. Part of the nerve kind of comes to the center of the head and then continues on.
Okay.
This is the optic chiasm there where they cross. This structure kind of sits above the pituitary gland, more or less.
Okay.
So that would also be nearby.
And they're above the meningioma?
Yeah, that's so maybe I can kind of show you.
Okay.
Show you for sure. But at least how I'm holding it in my head right now is, the meningioma would be sort of below and slightly kind of off to the side, maybe here
Okay.
roughly, but
Okay.
we'll see if my memory and what the
Okay.
MRI actually shows line up. Let's see. So I think based on what Dr. Mix kind of put in his documentation when he spoke with you last, it seemed that he thought the gamma knife would be feasible and safe in terms of avoiding these other things.
Okay.
But it's kind of a shared decision making with you about whether, do we just watch with MRI? Do we go for treatment now? And I'm not sure that there's really a right or wrong. It seemed like, and maybe he communicated this with you, and of course, when he comes in,
Right.
he'll speak for himself.
Right.
Dr. Mix was concerned, what if, heaven forbid, this thing does start to grow, even if it's slowly, could it cause those problems again, the double vision or something else?
Permanent issues.
Right,
Right.
that could be permanent, that's right.
And we'll be involving Dr. Mexico in the decision as well.
Yeah.
Because he's kind of lead.
Right. Yeah, he's Dr. Mexico is excellent, really a top specialist in this kind of area. The next appointment I saw was out in April. Does that?
She couldn't get me in it. Well, they accidentally scheduled the appointment for before the MRI, and when I think maybe the MRI got moved, and when I told them, she said that was the first they had, but she was going to try and put me on some kind of a cancellation list so that they could get me in sooner. So I'll contact them again and make sure that.
Yeah, so let's see if I can do this in a way that makes sense.
So Eddie, can you see?
So this is your MRI. I kind of have two views of the same image.
Yes.
This is the top of the head. These are the fluid-filled spaces in the brain, the ventricles. This gray horizontal line here is the optic chiasm. And here it is on kind of the top-down view.
Okay.
The meningioma is below that area. So here's the pituitary gland and the meningioma kind of off to the side. So it's actually even a little further away than I had in my mental picture. So that's a good thing. And let me double check myself, because as I'm scrolling, up is down and down is up on this thing. But this bar is telling me where I'm going. Yes. So if I go down, I get to the meningioma. If I go up, I get to the
see. So when you go in with the gamma knife, what does it have to go through?
Good question. So let's sort of the procedure of the gamma knife, you would come in early in the morning. You'd have an IV placed. We can give medicines for any pain or anxiety. There's a special frame involved. Dr. Mix talked about that?
Yes.
You'd have an MRI the same day, and we would use that to plan the radiation. Dr. Mix and his team sit down with that MRI and basically outline exactly where the radiation needs to go.
Okay.
The Gamma Knife machine has hundreds of tiny little apertures, basically. There are radioactive sources, that are always decaying, but they're only able to sort of, the radiation is only on, you're only exposed if the aperture is actually open,
Okay.
According to the treatment plan that Dr. Mix comes up with.
Okay.
So it's really hundreds of tiny little beams that all intersect at one point.
Okay.
So any one beam is a low dose of radiation and a very small, kind of beam, but it's where they intersect.
It's where they intersect.
At the meningioma.
Makes
where
sense.
There's a high dose.
Makes sense. Okay, so it's not hurting anything going in because they're all going in from different angles with slow doses.
That's right. There are many different angles
Got
that
it.
can be used.
Okay.
Very small, very precise beams,
Okay.
and the intersection of those beams is really the only significant
Okay.
radiation.
Okay.
Once you get even a few centimeters away, you're essentially dealing with, the background of the universe, so to speak.
Right.
So, doctor, is it safe to say that you feel that the risk to collateral damage to anything
is quite low. We know that we can't say the risk is zero, but I would trust Dr. Mix, if he thinks this is a safe treatment for you. Yeah. The things that he'll be watching out for are, of course, the pituitary gland nearby. Sometimes we have a patient get set up with an endocrinologist. That's a doctor who specializes in hormones, monitoring those levels to make sure nothing is out of whack. The brain stem is here. That's sort of the top of the spinal cord that connects the brain and the spinal cord. Dr. Mix would be very close to avoid that, but the risk of damage to those nerves technically wouldn't be zero. And then, of course, we've talked about the optic nerves that control vision.
Right.
Because you had a problem with that sixth nerve, I think the right thing to do is to say that there's a chance the radiation could damage that nerve as well. Hard to say, what the exact risk would be.
Right.
But probably the risk of damage over time would be higher, if the meningioma is sort of left to its own devices. Right. The hard thing here is knowing what's the chance of it growing enough to cause problems.
Right.
It's not an easy thing.
Makes me a little nervous leaving it in there.
So there's no experiential kind of, in my experience, I've done 100 of these.
So Dr. Mix probably could give you that kind of answer, is I've done this many in this type of location, and here's kind of the outcomes.
And also it was mentioned that it could swell after the radiation?
Yeah, so that's a possibility. After any course of Gamma Knife, it's possible that you might experience headaches, maybe some of the double vision or changes in vision that you've had before. If that happens, we would probably try steroid medications to try to calm that down. But I think most often what we see is folks feel a little tired, maybe for a few days to a week or so, and then are basically back, to their normal activity. We asked you to take it easy the rest of the same day as the Gamma Knife, but then there's no restrictions after that.
So what was mentioned by Dr. Babu's office was that the swelling could also damage surrounding structures, but I didn't know if that was if there was a high probability of swelling, or you don't know because everybody's different.
Yeah, I would say if there's swelling in kind of the surrounding brain, for example, that would usually be a temporary thing. If the meningioma itself were to swell, sometimes it doesn't shrink back down, so that's something that could cause sort of
Okay.
longer term problems. And the likelihood of that, I think, is maybe hard to say. So that may be something where,
Right.
Dr. Mix's kind of experience would come in there. There is also something called radiation necrosis. That is sort of festering irritation of healthy brain tissue, and we are nearby to some healthy brain there. The dose that we typically use for a meningioma means that necrosis is less likely to happen than if we were treating a true cancer or something like that. But that's another thing that you should be aware of in terms of possible side effects, that there could be this kind of ongoing irritation.
And that's what Dr. Babu's office said. Now, what part of the brain is that? What does that control?
Yeah, so
I mean,
this, I would say, is the temporal lobe on your right side. So it's not necessarily easy to say if there's irritation, you would have this symptom.
Right. Okay.
Usually over on a person's left side, there's an area that's related to language. There can be some connection with hearing and things like that, but I don't think it would be a one-to-one relationship between that area and
Of course, I do have ringing in my ears. I've had for a few years now.
Okay.
Hopefully, maybe that would make the ringing go away.
Yeah,
Probably not.
unclear. If I had to put a bet on it, I would probably bet that it's unrelated. Yeah. I'm just kind of looking at the nerve that's related to hearing, and I don't see. Is it one side, both sides?
Both.
Okay.
Unfortunately, they play a song constantly. It's very boring.
A question Dr. Mix often asks me is he wonders where people are sort of leaning before he comes in. Not that he intends to push you one way or the other, but.
Right. Well, and so we talked about this on the way up, and so, of course, Dr. Mexico will loom large in my decision.
Yeah, absolutely.
But one of the things